Hello, can you tell us your name, designation, and region of training?
Hi, my name is Atif Rana. I am an ST6 in the final year of training, and I am currently working in the East Midlands region.
Thank you. What rotations or group of rotations do you go through in your region in East Midlands?
In East Midlands, you basically have three major centres. One is in Nottingham, one is in Leicester, one is in Derby. So you mainly go through the neuro rehab in these three regions, and for amputation and trauma rehab, you go to Nottingham, and for your spinal injury, you go to Sheffield.
What does a typical week look like for a PRM trainee?
It depends where you're working, but most of the time you might have a couple of clinics in the week. It's mainly a 9 to 5 job, and you might have ward rounds and various other activities related to your ward cover. And you might have some on-call commitments if you're working in the spinal injury unit.
How does PRM compare to other specialties in terms of workload, stress, and burnout?
As compared to other specialties, I feel PRM is very well balanced. You have very little chances of being burnout because it's mainly Monday to Friday, 9 to 5 training, with very little exception. You don't do any on calls over the weekends.
And lastly, what's one piece of advice you would give to someone considering PRM as a long term career?
One main advice would be that prior to starting your training, go through the curriculum and see what deficiencies you have early on, so that in the early years of your training you can focus on those things, and then later on you can just build upon those things.
Thank you very much.
Welcome.